Hi everyone, and welcome to your Health Partner, brought to you by Lehigh Valley Hospital, Hazleton. Today, my friends, we're going to learn about the trauma program. It's a level 4 program up at Hazleton, and we got to learn. I know I'm going to learn a lot today, but before we start the show, I want to show you this video.
Hi, my name is Anthony Valent, and I'm the Chief Medical Officer here at Lehigh Valley Hospital, Hazleton. I'd like to take a moment to talk about our trauma program. Since its inception, our trauma program has provided state-of-the-art care to our community. It has allowed us to keep patients here when possible, and it's also allowed us to transfer patients to a higher level of care when needed. It has truly provided state-of-the-art care to our community and will continue to do so moving forward.
LVHN, EMS, and Medevac colleagues are integral to our Level 4 center as they transfer patients from the field via ambulance and via air and ground from the Hazleton campus to higher level of trauma care. Lehigh Valley Hospital Hazleton provides trauma care close to home when it's needed most. For patients who need to be transferred, LVH Hazleton has immediate access to air and ground critical care services. LVHN Medevac arrives via the helipad next to the ER entrance. Decontamination room is used for patients requiring decontamination. The hospital has a trauma bay close to the ambulance entrance. It can accommodate up to 2 trauma patients simultaneously. Equipment in the trauma bay includes surgical sets for emergent procedures, temperature control and warming devices, a high-volume rapid infuser, ultrasound machine, video glide scope, ventilator, mobile pediatric Broslow cart, and a mobile pediatric trauma cart. Just adjacent to the trauma bay is a Pyxis machine and refrigerator for emergent medication and antibiotic administration. The trauma bay is reserved for trauma alert patients and remains open and available for any incoming trauma alerts. The CAT scan is located just down the hall from the trauma bay. When a trauma alert arrives, the CAT scan is cleared and held for our trauma patient. Emergency room providers consult with our Level 1 Trauma Center partners, hospitalist team, and orthopedic providers to determine the next steps for trauma care. When patients are ready, they are taken to the ICU, which is outfitted with the required equipment to care for critically ill trauma patients. Here, patients will be cared for by nursing staff who have received specialty training to care for the most critically ill trauma patients. Trauma patients requiring admission, but not ICU care, are admitted to the Med-Surg unit on the 7th floor. When patients are discharged, there are many options to stay in the community for rehabilitation care. Our motto is, "It takes a team." The Lehigh Valley Hospital Hazleton Level 4 Trauma Center is a true benefit to the greater Hazleton community.
Well, now you have a good idea what the trauma unit is about. Now, joining me now is the medical director for the Hazleton Emergency Room and the trauma program, Dr. Kira Weaver, and also joining me is Melanie Bowman, who is the Hazleton Trauma Program Manager. Thanks for coming on the show. Trauma is something. I mean, you know, you don't know what trauma is sometimes until it actually happens to you. But before we go there, Doctor, could you tell me, what does a Level 4 mean, trauma unit?
So a Level 4 trauma center means that the hospital met rigorous criteria by the state that they demonstrate that they provide basically a standard of care, that's specialized trauma care for our injured patients. So not every center is able to achieve that. It's a lot of work with the trauma team, with the hospital. It's more than just the ER, it's multiple disciplines within the hospital, from respiratory to inpatient care, from our blood bank, our lab, radiology departments, EMS. It all integrates into a system on how we care for someone that has an injury. Define trauma for me. So trauma is a catch-all phrase for basically injuries. Okay, so it's based on, a mechanism, so something that leads to an injury or potential injury. And so it catches anything from a fracture to a sprain or it could be something more serious from a head injury to a collapsed lung.
How do you determine, how do you decide? I mean, if someone's coming in, is everyone, I mean, everyone's in trauma when they get to the emergency room or going to the hospital, but how do you decide what you do then?
Part of being a level 4 trauma center, we have a set of criteria of either, certain features of a patient or how they got injured that identifies, potential for serious injury. And so those things will expedite care in those situations, kind of like our stroke program or MI program. So that way those that may be most potentially injured or critically injured get identified and cared for first. The other part of it is, yes, some people will come in, you can have an ankle sprain, but that's a little bit less time sensitive on a trauma standpoint, and they can follow kind of our normal ED pathway. So it's early recognition from either the triage nurse, our charge nurse that may be taking in the ambulance report, or the doctors and like PAs and nurse practitioners that may also be, listening to the radio or talking to our staff out front a little bit about who's presenting in.
All right, so trauma then goes hand in hand with the emergency people when you bring a person in, correct?
Yes.
But you have to, how do you, then you establish if that person's in trauma by what?
So it has to do with what happened to them. So like, were they in a car accident? Did they fall? Did they have an accident on a bicycle? The story of the patient's a lot that plays a role into that. And then obviously what their, what we call their complaint, like, what hurts, is what will be the other part of that.
What are some of the conditions that you treat for trauma?
So probably most commonly when we talk about the term trauma, injuries related to falls and car accidents by far, are the bulk of our trauma. The other part of it would be maybe we see a lot in our area of like, work-related injuries, recreational injuries like ATVs, and then pediatrics is a little bit different in the sense that it might be more like bicycles, sports. Any of those things can really play a role into trauma.
All right. Now, so if a person's coming in, okay, and you consider the person as a trauma victim, okay, is there then a different approach you use than other than that person not being in a trauma?
If they meet our criteria for what we call our trauma alert,
what is that criteria?
So it's based on basically patients like blood pressure, heart rate, maybe some age factors, some things on, basically from their complaint or exam, like if EMS brings them in and they're concerned about that they may have a certain injury, or what happened to them if they, for example, if they fell out of a second-story window versus, they rolled their car. Like there may be some different things that play a role into that. That'll have us follow a certain pathway that we do follow, our trauma guidelines. Technically, for all patients, we approach it very similarly, but the time sensitivity when we have alerts is the big difference.
So that determines what course of what you're going to do in terms of treating that person, if that person is trauma or not trauma. Is there a different direction you go into?
So the tricky part is sometimes it overlaps because sometimes patients will have a medical condition, like a stroke or a heart attack, or they may be sick, with an infection, and they may have a fall, and that can lead to trauma.
What are some of the common trauma cases?
Some of the common things we see are broken bones. We talked about sprains before. That's probably the, lacerations, like, cuts, laceration repairs. Sometimes dislocations, like where you have like your hip or your shoulder out of socket. But some of the more complex stuff we see, which is still, not terribly uncommon, we see, head injuries, we can see, anything from like abdominal injuries, spinal fractures, things like that.
All right, now we have the medevac here, okay,
Correct.
and it's available 24/7. What are the advantages of the medevac?
So medevac is critical in that it decreases our time between hospitals. So like if the patient's too complex for our hospital here in Hazleton, it decreases our time between hospitals, so from physician to physician. The other part of it is, and weather is a thing up here. But it also provides specialized care by critical care nurses and paramedics, so they can provide a higher level of care for the critically injured patients. So there's some different medications they can provide that, our regular paramedic trucks may not be able to do.
Okay, so how well are we equipped, all right, here before they get on the medevac and you fly to Allentown, is that where you go basically? How are we equipped here versus what they have in Allentown? Would it have to be extreme for them before you move them down to Allentown?
It depends. So, trauma is viewed as a surgical disease, although a lot of times, surgery may not be something that happens. Like obviously orthopedic is probably the big bulk of our trauma patients that get surgery, but it is a specialty, kind of like cardiology, neurology, that requires that specialist care at the bedside. Now, there's opportunities here. We do provide trauma care up here. So like the life-saving interventions that a patient may need with trauma, like if they have a collapsed lung and they need a chest tube, or if they need to have emergent blood and be transfused. There's some different things that we can do and initiate up here to prevent, either serious, disability or, illness or potentially death. And that's where it's really important to be a level 4. That's that initial stabilization phase. That's what we can offer. If the patient goes, to get them stable enough to make a trip, potentially to a higher level center. Some patients that we have primarily orthopedic, we can keep, our more common orthopedic injuries here in Hazleton, and so they can receive our trauma team in the ED to care for them, and then their care will continue in the hospital between orthopedics and hospital medicine. But that's the big thing is we can provide that initial phase to try to stabilize that patient so they make it to the care and they have a better outcome.
All right, is there anything people can do in everyday life to avoid a trauma injury?
Yes, there's lots of different things.
Don't get out of bed.
Yeah, I was gonna say wear a helmet. No, so I think there's a lot of. It depends what you're doing, right? Because it's all based on what, like if it's a fall or car accident. So wearing seatbelts, when you're participating in certain sports, like skiing, riding a bicycle, motocross, like ATVs, you're wearing a helmet, wearing protective gear that you're supposed to for different, sports. When you're at work, practicing like to your employer's guidelines on what, to prevent injuries at work. Falls is probably the big one. Falls is probably the trickiest thing, and Mel's like our fall person here. But I think, it's everything, like when we talk about, the majority of our falls are geriatrics and they're fall from standing. So like, think about things in your house that may be hazardous, like you want to keep pathways clear, and, area rugs are kind of a slippery slope as you age because you can get caught up on them. Understanding your fall risk, like because your medications or your medical conditions, kind of using assisted devices if you're instructed to use them by your doctor, taking your time standing up and balancing. Those are some of the basic things. So it all depends like what activities or where that person is in life, where their biggest risk for trauma is. And probably, the best place to start, like particularly with geriatrics, is talking to their primary care doctor.
All right, so now the most important thing is the training, okay? And, making sure that the people that are taking care of you have been trained properly, okay? Tell me about, the training that the ER team goes through.
So a lot of the trauma skills that we have as an ER team, our ER team's trained in residency, like procedural skills. We get that foundation, but you have to keep it up and keep it continuous. So our health network's really robust in education opportunities. So there's training within the trauma program itself. We have several conferences a year that is open to our network. There's also, we have some programs like our Advanced Trauma Life Support, Rural Trauma Team Development course that helps build up the trauma team, not just the doctors, but like Rural Trauma Team Development course actually takes the team approach, because everyone in the trauma, like the nurse, the tech partners, blood bank, everyone has a role and participates in that care, that trauma care, and has to be done very time sensitively in a certain way. The other things that, our grand rounds through our emergency department, we have trauma topics that are covered through our, also from our trauma program, they come in our guest speakers occasionally. And then our emergency department, we have skills days and simulation open to us to practice our skills.
Now, I notice here we have a lot of accreditations, okay? We're talking about the trauma system. Talk about some of these accreditations that we have and why they're so important.
So we're a primary stroke center, we're a chest pain center, and we're a trauma center. We've had these accreditations, all three of them, for quite some time now. And they're really robust programs that, really work, fairly seamlessly, in the sense of, from the pathways that we follow to care for those patients, because of all three of these things are very time sensitive and critical. Some of these patients do have to be transferred, like when we talk about our MI alert, like our heart attack program, and then our, some of our trauma patients as well, and occasionally some stroke, although we do, the majority of our stroke patients actually do stay at Hazleton for their stroke care. I think it says a lot about collaboration, amongst the specialties and our team at Hazleton, but then also through our network. And we work primarily with Lehigh Valley Cedar Crest when we have patients that are more complex that exceed our capabilities here, but that's a network thing. And so we have to be really good in communicating and working with all the moving pieces in that. And so I think that says a lot for how we function as a network to provide that care, because it brings resources that may not be available, in a smaller center right here at the bedside in Hazleton. And it basically makes us be able to provide that standard of care for everybody. And that's really important for anyone that's having a stroke, a heart attack, or a serious injury.
So, doctor, tell me about your EMS background.
So one of the things that got me into trauma here at Lehigh Valley Hazleton was, prior to becoming a physician, I actually started in EMS in high school as an EMT, and then later became a paramedic. So I worked a few years as a paramedic before going to medical school. I keep a current pre-hospital certification currently, so I still run EMS as a provider with one of our local EMS services. I think what's nice about it is it really helps me understand, as a physician, kind of keeps me grounded in what they experience out in the field, understand that system, and I think that helps integrate it very well when it comes to that interface with the hospital.
Anything in closing you'd like to say?
I think it's a privilege to work with everyone up at our hospital and our network. This is actually my 10th year with our network, and I'm from the Hazleton area, so I always wanted to work for our hospital, since I wanted to become a physician. And so it's always been a privilege, and they're a really great team, and especially with these programs, it's something I think our community should be very proud of. And it's something that we keep working at, so we don't settle, between our performance improvement, and like I said, with education. So I think it's really great to be a part of that, and I'm thankful for that every day.
Folks, I'm talking to Kara Weaver, who is the medical director of the Hazleton Emergency Department and also the trauma program. Coming up next is Melanie Bowman. You thought I forgot about you, Melanie. She is the program manager at Hazleton. We'll be back right after this. Hi everyone, and welcome back to your Health Partner, brought to you by Lehigh Valley Hospital Hazleton. I'm Sam Lassant, and now Melanie Bowman, who is the trauma program manager. We talked about the Level 4 program, and what is a hospital trauma program?
So the trauma program, it encompasses a lot of things. Like Dr. Weaver had said, there's a lot of moving pieces to it. And it starts with our EMS colleagues, because that's usually how our patients arrive at the hospital, is by EMS. So EMS, ER, and then inpatient care, as well as all of the specialties that we can offer.
How well trained are they?
We are really lucky in this area because our EMS are top notch. We can see that when we review cases specifically. Dr. Weaver and I look at them, and there are very good examples of how our EMS colleagues take care of patients. So Hazleton is in good hands.
Good. What is the goal of an effective trauma program?
I think the goal is recognition, stabilization, and then knowing your resources and what the patients need, so that they can get to where they need to be or to stay here in their own community.
Who certifies the hospital as a trauma center, and what types of strict standards does the hospital have to meet to attain those designations? That's important.
So it is called the Pennsylvania Trauma Systems Foundation. We call it PTSF, and they have 28 standards that we follow to the letter, and I can tell you to the letter. It is a very strict accreditation process that we go through.
Tell me some of those things.
Okay, so they talk specifically about the commitment of the hospital and the community, and give you examples of things that we should have. They also talk about all of the nursing staff should be trained in a certain way to take care of trauma patients, as well as physicians. How do our physicians learn to take care of trauma patients? And they want to know that, and they offer things to help us do that as well. And then it goes down to all of the levels. So it talks about blood bank and what type of blood products we should have, and the lab and how quickly they should turn around, even EMS and what we should have to take care of our EMS.
So there's a lot of things.
There's a lot of things. Yeah.
Now here again, teamwork is always important.
It is.
Okay, extremely important, especially when someone's coming in. The patients, you know, they're in trauma sometimes. So, but tell us about the ER team and how you work in Hazleton with that, the quality of care that people should expect to get.
So our ER team for trauma patients have to be available and meet the patient within 15 minutes of arrival, the whole team. So that takes some preparation.
So when you say the whole team, when the arrival, you know who's coming in then?
Yes.
So that's when you gather the team, you know what you need when they're coming in?
Yes.
Okay.
Yes. Yes, and there are some specialized equipment, like what's on the video, some specialized equipment, state-of-the-art, that we use to take care of the trauma patient. But the team that responds is the physician, of course, the nursing staff. We do have radiology come to take x-rays. We have respiratory to help us with airways, and blood bank is available with blood.
You know, it's amazing because when you see ER and there's a person coming in, how everybody works together and knowing what to do and where to go. I mean, that amazes me, and making sure that, and you think they're helter-skelter, they know what they're doing. They're not going crazy, but they know what they're doing, correct?
Correct, and a lot of times if you are if you're watching a trauma in the bay, there isn't really much noise. Everyone is concentrated on their particular job. It's a well-oiled machine.
It's amazing how great the hospital and the network is. Wouldn't you agree, doctor? I mean, it just works fabulous. The training, what type of training do you go through?
So every doctor, like Dr. Weaver said, has to take ATLS. They go through most of them go through our residency program, where they work side by side with the trauma team at Cedar Crest. So then they bring that knowledge and expertise to us here in Hazleton when they work in our ED. The nurses, on the other hand, they have to attend a 16-hour course when they start with us. It's called the Trauma Nurse Course. It teaches them how Lehigh Valley Hospital takes care of trauma patients, which may be different than other networks. So it's very specific.
We talk about technology, okay, and I think sometimes what we have now saves a lot of lives because we have that advanced technology. Wouldn't you agree?
Yes.
Okay. So tell me about some of the things we saw in the video, some interesting things, but tell me how that technology now has been able to improve people's lives and save a lot of lives.
I think that the technology adds to our abilities, right? It doesn't replace a person's abilities, but it adds to it.
Oh, yes.
So some of the things that you may have seen in the video, they mention a glide scope. That is a very special piece of equipment to assist the physician in intubation if the patient's having respiratory concerns. Very good to have that. We also have ultrasound machines that can identify injuries without the patient leaving the bay. And so, you know, in these situations, every minute counts. And so the less movement you have to do with a patient, the faster you can get them out to their next level of care if need be.
Melanie, so tell me, what level of trauma center is LVH and working with Cedar Crest?
Cedar Crest is a level 1 trauma center.
All right, now, do you work closely with the team? So when a patient has to be transferred to the higher level of care?
Yes, we do. And we do that through our performance improvement program, which is very comprehensive. It goes across all levels. I work closely with the people that do the trauma program managing job at Cedar Crest, and the surgeons, the trauma surgeons themselves come to visit us in Hazleton every month. and we sit down and talk about cases that we may have had the month before.
The current concern would be, God forbid something happens to a person at 2 o'clock in the morning, at 3 o'clock in the morning. Am I going to get the same kind of care at 3 o'clock in the morning that I would get during the working hours, so to speak, from 8 to 5 or 8 to 6? Do I get that same kind of care?
Yes, absolutely. You get the same kind of care no matter what time you arrive. And we have the team, the standards are set and they are followed 24/7, 365.
Melanie, there are advantages here, great advantages, working with the network. Talk about some of those.
I think that the most important is the access that Lehigh Valley Hospital gives us with surgical specialties. So if we could think about just the trauma continuum itself, we have adult, pediatric, lots of things can happen in between, right? So we have an adult center that's a level 1, a pediatric center that's a level 2 center, and then we also have the only regional burn center as well. So it really is a comprehensive network.
Wow, it's amazing. You know, it's like I said, the bad news is something happens. But the good news, we have the great hospital that we have, and I can't thank you enough and all your staff. You know, just great. The bedside manners that I found, you know, particularly I had a procedure last week at the Hazleton Wellness Center in the surgery department, and from the moment you walked in, the nurses, the receptionist, in fact, all of them there at the Wellness Center are just great. I mean, they were fabulous. So my hat's off to both of you. Thanks for coming on the show.
Thanks for having us.
Okay. So my friends, hope you learned something about our trauma unit, second to none. The information's on the screen. Phone number's up there if you have any questions. Hope you learned something today. We'll see you next time.